Aloha and good morning, good afternoon, and good evening. Welcome to our webinar in celebration of International Women's Day, Women's Leadership in COVID-19 in the Indo-Pacific. This year, the theme for International Women's Day, Women in Leadership, Achieving an Equal Future in a COVID-19 World, celebrates the tremendous efforts by women and girls around the world in shaping a more equal future and recovery from the COVID-19 pandemic and highlights the gaps that remain. My name is Crystal Pryor, and I'm Director of Nonproliferation, Technology, and Fellowships at the Pacific Forum. We are holding this 90-minute webinar in partnership with U.S. Indo-Pacific Command to explore the critical role of women's leadership in responding to the ongoing COVID-19 pandemic. This webinar will consider how women leaders have handled the health and economic crisis and how their countries have performed in containing the virus. It will also underscore the importance of placing women's needs at the heart of pandemic response plans, investigating how recovery efforts can improve women's full and equal participation at all levels of decision-making. Please note that remarks made in today's program are on the record, and a video audio recording of this session will be made available on the Pacific Forum website and YouTube channel in the future. The discussion, which will include feedback and Q&A with the audience, will be moderated by Ms. Sharon Feist, Command Gender Advisor, Office of Women, Peace and Security, U.S. Indo-Pacific Command. Participants will be allowed to unmute their mics to ask questions or give feedback. Participants' cameras are disabled throughout the session. We also have a post-event survey we'd like you to complete after the event, but we'll share the link in the chat box now. Now to today's session, we'll do the 3 presentations together, followed by Q&A and discussion. This is a friendly reminder for the speakers to keep your presentations to 15 minutes so we can have ample time for questions and discussion. The session, again, is 1.5 hours total. Note that participants, you may raise your hand or submit questions in the Q&A box as you have them during the presentations. In other words, you don't have to wait for the very end. Today's presenters for women leadership and COVID-19 in the Indo-Pacific are Dr. Lin Qingyi of Changshan Medical University Hospital, Dr. Susie Wiles, Associate Professor, the University of Auckland, and Dr. Kara Jabola Karalis, Executive Director, Hawaii State Commission on the Status of Women. First up is Dr. Lin Qingyi, who studied medicine at National Taiwan University and Changshan Medical University. After earning her degree, Lin worked at the Changshan Medical University Hospital and as an obstetrician and gynecologist. Dr. Lin was elected to the Legislative Yuan in January of 2016. When the legislature established the UN Sustainable Development Goals Advisory Council of Parliament in September 2017, Lin was named the chairperson. In February 2019, she was appointed leader of the Democratic Progressive Party's International Affairs Department. Lin is supportive of amendments to marital law in Taiwan, so both men and women can consent to marriage at the age of 18. Lin and Yu Mei Nu have co-sponsored amendments to the Civil Code in an attempt to legalize same-sex marriage in Taiwan. Lin began attending parallel events hosted alongside the UN Commission on the Status of Women since 2012. In February 2020, Lin complemented the Central Academic Command Center on its actions during the COVID-19 pandemic and petitioned the Mainland Affairs Council to maintain its protocols when arranging evacuation flights from China. Dr. Lin, you have the floor.
Okay. I'm Lin Jingyi, so happy today and to share some experience and some viewpoint with everyone. Of course, first, happy International Women's Day. Of course, initiate, I guess, topic want to talk about female leadership in pandemic. But first, I think finally I want to pass on the conclude or in the viewpoint about what will be happen during pandemic in gender equality base. First, let me share the infection condition in Taiwan. In Taiwan, our first case of COVID-19 was noted on January 21st, 2020. It's very early, I think, in the global to note about the pandemic situations. And this first case, she was a Taiwanese woman worked in Wuhan. Actually, that is a very interesting issue that in past decades, many of Taiwanese people work in mainland China, but most of our populations were focused on male work in China. So actually, the first one case infected in Wuhan, and she is a woman. That is a very special issue for Taiwan because it's broke the most of the people's viewpoint that most of the work in China is men workers, and because she was our first case in COVID-19 pandemic. Until now, we have total 969 confirmed cases. 10 of them are deaths, and 853 are imported cases. The imported cases we define that, classify that is if they get infected outside of Taiwan. That is important because we need to separate what kinds of infection resources. And we have local acquired cases are 77, and the 36 cases are infected in fleet. The 36 cases infected in fleet is have one in 10 of them are female. So that the fleet cases is very special in Taiwan because all the cases that all the patients most of them are young men. So in our society also have some discuss about what will be happened when this is young men they leave the fleet and how their families, their girlfriends were affected the disease. But in very lucky we have not anyone any local acquired from the fleet issues. And the important that we are two healthcare associated cluster infection in past 13 months. As a medical doctors in Taiwan, because we had to suffer from SARS pandemic in 2003. So all the Taiwanese health workers, we need to training about the pandemic, about how to prevent the healthcare association infections. So just in the initiate of the pandemic, I worry about a lot is what will be happened in our nurses and the basic the health workers, especially the health workers in the midwife centers or the ordinary centers or the nursing centers. Because when that situations, maybe the most affected are young girls, the young nurses, and most of Taiwanese nurses, over 90%, they are women. But in this is health case associated cluster infections. Most of the infections cases are women. It's very regular in Taiwan because most of the nurses are women. But of course, most of them is related about their work. Most of them are nurses or the patients' sisters, patients' daughters, patients, and many of the patients are male or female. Of course, we still have another issue is migrant women. Most of the migrant women in Taiwan, they work here as a healthcare staff. So many of the migrant women in Taiwan now we worry about if they will become the infection cases or the risk cases, because that is really a gender-related risk in Taiwan because of their job. But in the two healthcare association cluster, we have only one migrant workers from migrant workers from other countries, and she infected not from her health patients. We do not know her or the origin, but finally she did not to infect her patients. So the health workers cluster infections only two cases in Taiwan. But I worry about first is when pandemic issues, especially about last May in Taiwan, we have more cases infections. Some come from the not a local acquired, or some it was some were imported cases. So here's the pictures. They are the hygiene keepers or the environment the cleanser. Most of them are women and middle-aged women. So we could imagine if the pandemic situations or we have social spread of the pandemic, most of them are very dangerous in the society because they need to do the most dirty or more the dangerous, risky jobs. And most of them, for example, the pictures, they are the clean keepers in our rain stations. But I want to say, because we keep the pandemic or keep the infection situation stable, so there is not anyone, the housekeeper, the hygiene keepers, or the station cleaner or the hygiene cleaner infected the COVID-19. Because we had ever experience of 2003, the SARS pandemic in Taiwan. And during the SARS pandemic, we have many nurses deaths cause of infections. And some of them and several of the hygiene workers in hospital, they also deaths because of SARS. So these times when the pandemic initiated, or when we have first case in last January, we make sure several things. Very important is how to keep the personal protection equipment is available. But usually people will think about the personal protection equipment in doctors, important workers, but usually you will forget about the most important but the most risky workers, especially, and as we know, the most risky workers maybe are middle or old age women because their work usually difficult to have the job with more technicians or more skillful. They need to get the very difficult jobs to have a lower the payment. So when the initiate about we face the COVID-19, and we try to our government try to try to have the needs about equipment, especially personal protection equipment for every workers, we make sure several very important policies. First is to make sure that all the medical staff, nurses, doctors, the technicians, and the hygiene people, hygiene workers in hospital could have the same, very enough, the personal protection equipment. That is very important to, I think that is very important to protect all the workers, especially the middle-aged or weak-needs women, because their work is so changeable and they are so difficult to have the resources. And second, also, we try to make sure all the workers, employees, they could have the equipment. So government connect with all the companies and try and make sure all the companies could provide the face mask or the hygiene equipment to their employee. I think that is very important. Maybe that not talk about gender, but actually that will protect the women's. So so finally we have only one acquired cases are hospital cleaner in the very early of the pandemic. And she and her colleague in hospital, the nurses, actually they do not know they are caring about the patients of COVID-19. So so first I want to share is to make sure the weakness population in your society, especially the middle or old age women, and especially the health workers, housekeeping, or the clean keeping workers, there will be very key point to protect women and protect their health and protect their economic ability. I think that is first very important. I think I find in Taiwan in that pandemic. So during pandemic, there are not any public clean workers of situation or public environment infected in Taiwan. And I must say many of the women's workers, they are also the taxi drivers, and many of them are the hotel cleaning workers. And in Taiwan, we have another policy that all the people, when they come back from outside of Taiwan, they need to consultations in hotel or in their house. If they stay in their house, they need to keep them only one person in one building. It's very important that to prevent their family be infected. And all we know during pandemic, during normal life, women are the most important care, the housekeepers and the care persons that to provide the food, the hygiene in their house. So try to make sure that only one person in one building. It's important that to protect their families, especially children and women. So many of Taiwan's foreigner people, the migrant workers outside of Taiwan, when they come back to Taiwan, because they have not the impossible to have one person, one buildings, so they live in hotel. The policy prevents their family get the infections, and also just like I mentioned earlier, important that the employee in different work, if they could have the equipment to protect themselves, that the workers in hotel, workers, the drivers, taxis, or the hygienes, keepers, women, they could protect, not be infected. And because of in Taiwan, we really keep normal life actually. Only we need to do is to wear our face mask in public area, in public environment, this on the trains, on the public in the buildings, and so our school are normal, and all the economic activity are normal. Of course, I think in globally situations that all the stores initiate of the pandemic, many of the restaurants are closed. But in Taiwan, actually we have not restaurants are closed, and that is most important. That most of the women they did not lose their job or their the economic charge in their life. That is important. That most of the Taiwanese women, especially younger women, their jobs are, we say, the store manager or the store only work in restaurant or the in the store. So not we keep the normal life, actually that could keep our women, especially younger women or middle-aged women, could keep their normal life. And also because our school are normal, or not any school are closed. So or the mothers or the women in house, they do not need to stop their jobs. They could have their normal life. So I want to conclude and a point that first, that the more gender equality society, the society will be more tolerant during pandemic, because you care about all the different genders, and when in the societies, different genders, people, especially the workers, they could have the same the same opportunity to be protected, that we could make to tolerate the pandemic. Of course, in today's topic, want to talk about the female leaders in pandemic. Actually, I do not really want to specialize that, because when we talk about what kind of gender is better in pandemic, also we're sometimes will be talk about the leadership related about the testes or the uterus. So, but I still want to mention something, that the female leader usually trust the team. the team workers, not such self-centered or not too much conceit to their mighty. I think maybe that is based on as our cultures that the women not such be encourages that to them to show their mighty to be brave to everyone to show I'm such heroes, I'm such strong leaders. They used to communicate and they used to support the team, just like most of women work in the society. So we could see so many male leaders as such regulars when they face the pandemic. It really makes them people suffer from pandemic and even themselves suffer from the pandemic infections, the COVID-19 infections. In Taiwan, our president, as everyone knows, the president Tsai Ing-wen, she's a female leader, and their team alerts the where pneumonia actually in late of 2019. And it's just very close to our president and parliament member elections times. And the first COVID-19 case confers just 2 days before our traditional Lunar New Year vacation. So that is a very huge challenge to the teamwork. And 1 week after that, the president still has her public activities in the Lunar New Year's, and she attends these activities as usual. Even that times, all our the doctors and nurses are worried about the pandemic, and but at the same time, she attend these activities as usual. Most important is that she want to prevent our population have the panic. But at the same time, actually, she organized important policies, including the face mask production line and ban the foreign visits, especially during that times the visitor from China. So during the pandemic, our president chose the professional publications, the team publications health teams, and keep the leadership of Minister of Health and Welfare. Or the public, most of the policies decision makings are based as public health health teams and our Minister of the Health and Welfare Minister. And our president should play the role to make sure the human resources is okay and all the protection equipment supply, to keep the supply chains and to keep the policy very clear based as the professional viewpoint. So I think the female leaders most used to maintain the teamwork, not to be interfered by the traditional hero image. So it's maybe that is important the way they confront the unknown disease or challenge. They could have a different stereotype or to work when we face the pandemic. Thank you.
Thank you very much for that. And next up, we have Dr. Susie Wiles. She studied medical microbiology at the University of Edinburgh, followed by a PhD in microbiology at the Centre for Ecology and Hydrology in Oxford. She spent almost a decade at the Imperial College London before relocating to Aotearoa, New Zealand as a Health Research Council Hercus Fellow in 2009. Dr. Wiles heads up the bioluminescent superbugs lab, where she combines her twin passions to understand infectious diseases and find new antibiotics. In 2017, she published her first book, Antibiotic Resistance: The End of Modern Medicine, and recently collaborated with her daughter to make a kids show about microbiology. Dr. Wiles has won numerous awards for her research and science communication efforts, including the UK National Centre for the Replacement, Refinement, and Reduction of Animals in Research 3Rs Prize, the Prime Minister's Science Media Communication Prize, and Royal Society's Te Aparangi's Callaghan Medal. She's one of three finalists for the 2018 Kiwi Bank New Zealander of the Year Award, and in 2019 was appointed a member of the New Zealand Order of Merit for services to microbiology and science communication. Dr. Wiles is a prominent public commentator on COVID-19 in New Zealand, and we're interested to learn from your expertise as a microbiologist and also your efforts for science communication during the COVID-19 pandemic. You have the floor.
Thank you very much for the invitation to come and speak today. So I'm just going to use a few slides to illustrate my talk as well. So let me just get those up. And I'll do the same. So I'll start with just a little bit of an introduction to how COVID-19 has played out in New Zealand. We were very much following Taiwan's lead, although not fast enough, I think. And certainly things like the, having what we call the alert levels here. So having a real plan of how the country will respond, it was absolutely pivotal for us. So our first case that we know about in New Zealand was on the 28th of February in somebody who had returned from Iran. And really within less than a month later, we basically went into a countrywide lockdown, one of the strictest that the world has seen, where basically we stayed at home. Everybody who wasn't an essential worker, which is people who were involved in basically food production, healthcare, keeping electricity, gas, those kinds of essential services working, everybody else was at home for several weeks. So what you can see here is, this is basically just a little, graphic showing how our cases went during that time. So we have the top graph is basically our confirmed cases per day. We have those linked to overseas travel in blue, and then those linked to or locally acquired, so community transmission in gray. We were not as good as Taiwan at stopping community transmission, but essentially what happened to us was obviously lots of New Zealanders returning from overseas or moving around brought the virus here. That triggered community transmission because we weren't doing enough of the things that would stop community transmission. And as cases started to grow exponentially, that's when we entered this, what we call a level 4 lockdown. And we were in that for several weeks and saw our cases go down. And the thing that we did, so New Zealand took an elimination approach, which was that we would get our cases down to the level that they would be able to be stopped using the contact tracing, testing and isolation strategy. What was really clear was that we had to go into that level 4 lockdown because our contact tracing ability was basically zero. And our testing capacity. So all of those things we really didn't have in place. And the lockdown was basically when those things were essentially put in place so that when we came out, we could try and use contact tracing and testing and isolation to stop further cases. But our lockdown was very, very, it worked very well. At the same time, we closed our borders, and our borders remain closed except to returning New Zealanders and their families. There are some exemptions for kind of essential workers. There's been some exemptions for sports people, but they're on a very much an application basis. So we are still pretty much closed down. We have here basically anybody coming into the country goes into a managed isolation. So we've taken over, the government have taken over a number of our hotels. And so people are put into straight into a hotel where they stay for 14 days and they're regularly tested during those 14 days. We have a separate hotel or separate hotels around the country, depending on where people are, for those who test positive. So they are removed to a hotel where there is a much greater level of, where they can be cared for and things like that. If people don't agree to a test, they can be kept for a further 2 weeks. And we've just had quite a famous case of an Australian who came over. It seems to make a point about, she doesn't seem to believe the pandemic exists, and she doesn't agree that PCR testing works. So she refused the test and ended up staying for an extra 2 weeks. I'm not sure whether she's been able to return back to Australia yet, because in order to return to Australia, she needs a negative test result and she won't take a test. So it's been kind of an interesting little story going on with that. Anyway, so we've had, so at our peak, we had about 80 cases a day. We've then had, just really 1 to 5 cases per day, which are people in this managed isolation. But since then, so since the first kind of wave, we've had two basic outbreaks in New Zealand. And we haven't really identified the source of them yet. One of them was, it appeared in people working in a cold storage place. So it may well be that it came into the country from some kind of cold storage thing, though nothing was ever identified. That was in August last year and peaked at about 10, 15 cases a day. We ended up with about 100 people in that cluster. And then we've just recently had another cluster of cases, 15 before it was basically controlled, which the mother of one of the families works sorting laundry for international flights. And so that seems the only, well, it seems the most viable way for how it's come in. So yeah, so we've had this, so we did this big lockdown. We've basically been more or less normal since then, apart from tourism. So tourism and international students are basically our two industries that are gone. And that has impacted on jobs and things. But we've only ever gone back up the alert levels when we've had these two other clusters. So Auckland's just coming out of this now. This is just to show you that, you know, as happened everywhere else, when New Zealand's pandemic was triggered by people returning from everywhere. So we've had every lineage come in. Now we're using genomic sequencing to basically track everything. So every case that comes in where possible is sequenced. And that's how we found out our most recent cluster was with the B117 variant. And so what we're also finding is that perhaps the things that we've had in place that have worked against the previous variants might not work quite so well against the newer variant. So we're kind of adjusting our processes as we go. We're using, I guess, what's called the Swiss cheese model, which is basically lots and lots of interventions lined up and you use them as necessary. So we obviously have these border controls using test, trace, isolate to stop any clusters or when cases are found, if they're small enough to do that. When we've had these cases that have appeared, we haven't been able to make a direct link to our border, and it's unclear if we've had people infectious in the community. We've basically used these closures, school closures, workplace closures for a short period of time to see whether they're, you know, to try and contain the outbreak, and then use test, trace, isolate for further from that. We have been really bad about mask wearing. It's not something that's really done, in New Zealand. We're trying to get better at it. It's become mandatory at our, what we call alert level 1 and 2, so kind of normal life, but only really on public transport. I think this is something that we need to do better at, but it's not really something that's people are sticking with. And we're just about to introduce vaccines have just become our latest thing. So in New Zealand, we got our first shipments of vaccines a few weeks ago, and we're starting by vaccinating everybody who works around the border and in managed isolation. So that includes all the cleaning staff, everybody and their families. And then as more vaccines come in, we will expand. The prediction is, or the expectation is, that everyone will be vaccinated by the end of the year, and then we'll see how that goes. So we have a woman prime minister who has, she took a very hard line at the beginning to say that she was going to, that a health response to the pandemic was going to be good economically. And that was, she did a big stand up saying, I will not accept anybody dying. We have had 2,400 cases here, 26 deaths, but a lot of those cases have basically been in people, coming back from overseas. And so she said that basically a health response was the right response. And it's really interesting how it's led to, it gave me one of the examples of countries who are led by women, is this something about women? And when I got asked about this early on, it was kind of before anybody had really done any studies. And there's been a couple done that really have shown that actually it is women. And I think that is to do with the kinds of women that we have in power compared to the kinds of men that we have in power. But this is one that looked at a data set of 194 countries, basically showing that when they matched countries, the ones with women did better in terms of cases and deaths. And that's even if you took out the outliers like Taiwan and New Zealand, and you took out outliers like the UK and the USA, you still got the same response. Another really interesting study looked at the USA and at different states, and they showed exactly the same thing, that governors who were women were much more likely to, their states were much more likely to do better than states governed by men. And a lot of these things are talking about how the women seem to act faster, putting in stay-at-home orders, so taking that health response rather than the economic response, knowing full well that people need to be healthy in order to have a good economy. And what was also really interesting about these is they've looked at briefings and shown that women were more empathetic and more confident in how they were approaching things. And so I think that communication is also really, really key. And certainly our Prime Minister has got a degree in communications. Our approach in New Zealand was to talk about us being a team of 5 million, that everybody had a role to play in this team. And the tagline for our sort of countrywide response has been Unite Against COVID-19. So it has really tried to be, building that teamwork, building that empathy for each other, that we're working for each other. At the moment, the tagline for wearing a mask is cover for each other. So it's very much trying to take things away from being individuals and working as part of a collective. What's been really striking, we haven't really seen it here in New Zealand because we're very small and we don't have many commentators, and because I'm one of the very prominent commentators, I think women in the media have been quite prominent. But I really was taken by the study that looked at, this is I think in the UK and the USA, how basically media voices are dominated by men, unless it's something to do with a woman's issue like childcare, in which case women are allowed to speak. And I think this is really interesting, right? That we have really good data, and not just from the pandemic, but from all sorts of things, about how good women are at leadership, and how, how they really, when you have mixed teams and when you have lots of women involved, you do really well. And then we see that the representation in terms of expertise is completely missing. And it's been interesting being in New Zealand and having people from North America, usually men, on social media telling us that our response has got nothing to do with the things we've done. It's all because we're a tiny island in the middle of nowhere that nobody wants to visit. So it's kind of, I think this really speaks also to how women are belittled, and what we do is really undervalued. So this brings me to my main point, which is that people constantly underestimate, undervalue, and undermine women's contributions and expertise, and question our motivations. And as one of the prominent science communicators during this pandemic here in New Zealand, this is absolutely what I have experienced. And we had a really good example of this last week. So as we were moving basically up our alert levels because of this latest cluster, myself and my colleague Sean Hendy were asked onto breakfast television together, and we did an interview together. So I have 20 odd years of experience in infectious diseases as a microbiologist. My colleague Sean is a physicist, and he is one of the team who's been modeling what the outbreak might look like here. So kind of infectious diseases is something he's got into quite recently. And when the news company, the media company, put this photo of us up online, and then put a link to our interview, where we were basically saying the same thing, which is essentially we just need to be cautious, of cases. We had this this person in the community. We may well see lots of cases. The abuse that I got online was really quite staggering. People questioning my my expertise, but not the physicist. So it was a kind of really good example of this really gendered way that we're treated. And I want to finish with this, which is that when one of the things that I would really like us to deal with is that when women do stand up, and this is especially, I think, relevant to the theme of this year's International Women's Day, is that we get a huge amount of vitriol. So these are just comments that I've picked from a Facebook page, which is the Facebook page of one of our politicians. It's an opposition politician, a man, who basically called me a COVID celebrity. So he's questioning my expertise, and also why I've actually been communicating, which is that I want people to understand why we need to why we need to do the things we need to do. And everything is very much about my lack of credibility, my appearance. And this is one of the things that I think that we really face, that women who step up and are experts are basically undermined all the time. And it's incredibly frustrating. And it's something we have to deal with in this recovery, is dealing with people's, both men and women's, I guess, attitudes to women's success. And I think one of the great successes of the patriarchy has been weaponizing women against each other. And that absolutely has to stop. So I think with that, I will end. Yeah, thank you for your attention. And I'm really looking forward to the discussion.
I think that was really a great, interesting talk about COVID-19 from multiple perspectives, and I really appreciate you sharing those, all sorts of information. I'm still processing the feedback that you got, but anyway, looking forward to discussing more for sure. But last but not least, we have Ms. Kara Jabola Karalis, who is the Executive Director of Hawaii State Commission on the Status of Women, a statewide feminist government agency which serves as the main policy consultant on women and girls in Hawaii. She recently led Hawaii to become the first and only state to allow any person with a prostitution record to vacate their conviction, except for sex buyers and pimps. Previously, Kara directed the Hawaii Coalition for Immigrant Rights, where she passed landmark legislation that extended driver's licenses to undocumented immigrants. Kara is also a founder of Affirm Hawaii, a Native and immigrant-led feminist activist organization. She earned her Juris Doctor from the University of Hawaii with a specialization in Native Hawaiian law. Kara, the floor is yours.
Aloha, everybody. Thank you so much for having me. I am going to talk a little bit about, I guess, our case study from Hawaii and pivot more to away from kind of the health response to the economic recovery that we've had. So I think the case study, as biased as I am, is really indicative of a new direction for women's advocacy and feminism in the United States. So I think that's really exciting. And if I could characterize two of the major themes of our feminist economic recovery plan, are it being internationalist and it being very class conscious. So very much influenced by revolutionary socialist movements that have defined a lot of our backgrounds across the world, and also just being an open confrontation with an economy based on profit and gain. I've noticed during the pandemic, I sit in most of the closed door response meetings with other government officials, and there is open criticism of capitalism explicitly named, which I never thought I would see in a very stifling and conservative setting, mind you. So I think this moment, as challenging, as devastating as it is, and we hear so much talk about how much women's equality and women's status is backsliding. I think this is an incredible moment in terms of organizing people to push for a politics and a resistance that deviates from kind of the very confining respectability politics that we have to deal with when we're doing women's advocacy at this level. So, patriarchy, white supremacy, and class oppression are, of course, global. These systems metastasized through colonization in many places like Hawaii and other places in Southeast Asia and the Pacific. And just like we would never treat advanced metastatic cancer just at the primary site, right? We cannot just treat it locally. And so I want to start with an anecdote about how Hawaii's leading really the United States into a deeper analysis on its responses. So first, last week, some of you may have hopefully saw the kind of blockbuster progressives in the US House of Representatives introduced what they called the Care for All agenda. And it basically, reframes caregiving as an infrastructure investment, and that it should be an industry developed, right, in the United States to fix this really unreal care gap that we have. So, it tried to be comprehensive, and it talked a lot about, right, like focusing on, if we pay these Black and Latinx and Indigenous and immigrant people okay and give them labor rights, then we're all good, right? But to us, from our perspective in Hawaii, especially many of us having been displaced from places around the world here, it really exists on this colonial continuum of extracting labor from our homelands and continuing a system that relies on privatizing a lot of this, and doesn't question or interrogate neoliberalism as a process and an ideology that's dominant in government and policymaking. So, we still see care being put on the individual, on the nuclear family, and not on the state. So, for us, we wanted to really talk about the value system that we want to attack, because we can put together whatever recommendations for a new economic order, but if it's based on the same principles of individualism, on autonomy, on a lack of interconnectivity, on growth, exponential growth and profit, and quite frankly, maleness and manhood, all the things that, we need to be in control, and that means we are not accountable to others. Those type of values will lead inevitably to the same exploitative master-servant relations that reflect in our economic system. So in Hawaii, what we did as a government agency, like Dr. Lin talked about, we pulled together a team. We wanted to really be conscious of counteracting what we saw across very masculinist governments and authoritarian governments, which was this leveraging of the crisis to seal off accountability to the public, to seal off, being collaborative. And so we put together last March a group of women. They weren't in government. Some of them were student activists. Some of them were public health officials. They really ran the gamut in terms of not just their identities, but their expertise levels. And we tried to really be anti-elitist about it as well. But we put together a feminist economic response team to COVID-19. Part of it was rapid response, just like keeping our head above water, knowing what was happening in the community, in different communities every single week. So being able to respond to things like, because we're an archipelago, abortion services being cut off to the neighbor islands because the only way over was doctors flying over, and then those flights were cut off, right? So we're an island chain. So suddenly overnight, reproductive access was cut off because of sexist government policy, and not counteracting, something that we would have seen, miles away. So that was just one tiny example of the things that we were dealing with. At the same time, some of my fellow panelists talked about, mainstream economists are the voice of God to legislators. They are very powerful lobbyists, whether they intend to be or not. And many times they are hired guns to formally lobby for different projects at the state and county level. And they put out their authoritative blueprint initially for the state on COVID-19. And it did not have the word woman in it once. It did not have the word childcare in it once, right? During an epic failure of the school system and childcare system. And so it was obvious that we had to step in immediately, because the default in that void is to reproduce very, very patriarchal structures. And so we wrote the Feminist Economic Recovery Plan from the state of Hawaii that was put out. We wrote it in about a week. And it was basically just moms and other folks contributing, and some were academics, some were not. Like I said, it was really a broad spectrum, so we're lucky to have that. And I'm not gonna belabor it here, but just as a sneak peek, it really talks about system change and not being shy or polite about that any longer. Really for us, it was about interrogating the way that our current economy impacts working class women, and centering working class women, which, they're rarely centered in our advocacy work, because they're not reflected in that work by the people there, who are homeowners, who are PhDs, et cetera. So for them, this economy is not working. And our economy in Hawaii is based on three things. Tourism, we have the highest unemployment rate still to this day. At one point, it was at 40%. It failed us instantly, and those jobs were already failing us. They were, very low paying, feminized, the unionization rate very low. And the other thing is, of course, we're very reliant on militarism in Hawaii. And this brings a host of dangers to women, quite frankly, in terms of just domestic violence, sex trafficking, other impacts that have been intergenerational in Hawaii. And then finally, speculative real estate and luxury development and the vacation rental industry like Airbnb, which has just vacuumed up our scarce housing supply. So that is the economy that we were in crisis in before the pandemic. And during the pandemic, it was very clear that we wanted to use this moment to leave that behind and build something new. So check out our feminist economic recovery if you haven't. I'll leave it at that because I love, to make sure that this is participatory and engage if folks have questions. But thank you so much, Kara Jabola-Corollas, for the Hawaii State Commission on the Status of Women.
Thank you so much for providing that perspective from Hawaii. It's really exciting to hear the ways in which our relatively small state is actually perhaps leading the entire country in providing a feminist perspective, and also how we can use the pandemic to actually make the positive change we really need to in our state and our country and globally as well. So now we're going to, well, thank you all three for the excellent presentations from three really different perspectives, all of them highly relevant to women leadership and COVID-19 in the Indo-Pacific. I'll now hand over the proverbial mic to Ms. Sharon Feist, Command Gender Advisor, Office of Women, Peace and Security at U.S. Indo-Pacific Command, to moderate the Q&A and the discussion. Sharon?
Thank you, Crystal. And aloha, everyone. It is my pleasure to be here today, moderating this panel of truly dynamic and inspiring women. And I'd say your nations and our region are very fortunate to have your experiences and your perspectives and expertise. So as Dr. Pryor mentioned, I'm the Command Gender Advisor for the Office of Women, Peace and Security within the J9 at U.S. Indo-Pacific Command. And we're honored to partner with Pacific Forum today on this webinar celebrating International Women's Day. And you might be asking, so why is the U.S. military involved with International Women's Day? And to put it simply, for strategic reasons, the U.S. Department of Defense recognizes that women are key to peace and security globally, and we cannot afford to overlook the needs, perspectives, talent, innovation, and capabilities of half of the world's population. Including women just makes for better security, and the importance of including women and promoting equality to strengthen security outcomes, especially in response and recovery from COVID-19, cannot be overstated. And as a quick example for some very specific statistics, you may not know that women's status in a country is in fact a predictor of peace. Where women have few rights or opportunities to participate in decision-making, there are higher levels of violence and conflict. There are higher levels of gender equality. They make a nation state more likely to threaten, display, or use force. And the data demonstrates that changes in the treatment of women are also among the first indicators of instability. Furthermore, women also show an aptitude for building peace coalitions and for creating dialogues and compromises among parties to conflict. In fact, peace agreements are 35% more likely to last at least 15 years when women are involved. So for the US military, a gendered security approach, which essentially means factoring in the different security needs of and impacts to women, boys, men, and girls, can help us better understand some of the most complex issues in our region, whether it be conflict or crisis related, including responding to and recovering from this pandemic. And this means acknowledging that many of these issues certainly exist due to years of conflict and instability, but also from the lack of empowerment, representation, and perspective of and from women. And this really is the heart of the global women, peace, and security agenda set forth by the UN Security Council Resolution 1325. And this is exactly why we've partnered with Pacific Forum to highlight these perspectives today. U.S. Indo-Pacific Command is committed to advancing women, peace, and security objectives within the Indo-Pacific region in alignment with higher policies and legislation, such as the U.S. Department of Defense's Women, Peace, and Security Strategic Framework and Implementation Plan, the U.S. WPS Strategy, and the U.S. legislation also known as the Women, Peace, and Security Act. And that kind of wraps up some of my overview comments from my perspective. And I'll now begin to moderate the questions for this portion of the webinar. We have about 35 minutes remaining for Q&A. And before we dive in, I did want to go over some quick Q&A admin procedures. You have two options for asking questions or making comments. One is to raise your hand in the webinar controls accessible from the participants tab. And the other is to open the Q&A window. To ask a question, you can type in your question into that Q&A box and just click send. If you raise your hand to ask your question verbally, the host will enable your microphone and ask you to unmute yourself. So please be ready to unmute yourself then. If your question is directed to a particular speaker, please identify the speaker in your question. And as we're waiting for questions and comments to come in, I'll begin first with a question directed to all of the panelists. And that is, overall, the global conversation around women, peace, and security, or WPS, what I spoke about earlier, is that we need to move away from women having to make the case over and over for inclusion into international or domestic peace and security processes. And we must instead rely upon institutions and systems for concrete and lasting change, which is something we've seen in pandemic response and recovery. So this is kind of a two-part question for the panelists. The first question, or the first part is, what can your governments, institutions do to better support gender equity and gender equality, not just in pandemic response, but overall? And second, we recognize that men also have a critical role in the global WPS agenda. In your line of work, how do you engage men and boys to advance gender equality, especially in COVID-19 response and recovery? And so with that, I'll open the floor up to the panelists who want to respond to kind of this two-part question. First, focus on institutional responses and mechanisms, and then the second part about engaging men and boys. Over to you.
Who wants to go first? I guess I can. So I guess I'm not really involved in government. I'm able to feed scientific advice to government, but I'm not involved in any of those discussions. What's been really interesting in New Zealand so our economy took a hit. It's doing very well now, but it's very clear that we've got some industries that are really suffering. And in order to I guess, help the economic recovery, the government set up a whole bunch of what they called shovel-ready projects. So things like construction, they were basically, if you had a project that, and it really was a building project, that was, ready to go, then basically the government would help support that by helping fund it. And it's really clear that response really, is all about the kinds of industries where men dominate. So even in the recovery, they've been, men's activities have been kind of lifted. And there's been a real call actually that we should be changing that response, and we should, that there are lots of projects that could be the equivalent of shovel ready that were, less masculine projects. But it's kind of interesting that nothing really coming from that. So we at the moment have one of the most gender diverse and diverse in general kind of governments, and yet there's still a lot of almost behaving a little bit like business as usual. So there's some disappointment here, I think, and it just shows that actually this process, it requires the kind of roadmap that Kara's written, right? So I'm going to be sending that to everybody I know, because they do need to be thinking really differently about it. And it's been interesting that they haven't thought really differently, or if they have, it hasn't come through in actions, I think. I don't know whether anybody else wants to answer that part of the question.
Yeah, may I have some First, I want to talk about how we could in the recovery in Taiwan. Actually, during the recovery situations, of course, I mentioned because we have less effect. Of course, we still have some effect by pandemic, especially some special jobs. But during the recovery, actually, first, I of course, at the same time, I'm not working government now, but I also suggest them to try to changing the new economic models because facing the pandemic, or we do not know what will be happening in the future. But in Taiwan, especially women, many women they have not the budget or the business models could to have a very big store or big economic the values, but usually they kept it. But during this pandemic, because many of our in Taiwan the consumptions or the economic models are changing. Many people try to have a buying model, buying buy on the internet, or they go through not go to the real store. They try by people connections, and actually that is a opportunity for women that they have not the budget or the ability to build a big building or big store, but they could selling their productions by online or by different models. So I think this is an initiative that for people, especially women, could to build different economic models. And first questions, in Taiwan, our Minister of Health and Welfare actually and his decision team, since pandemic, he have the report every day to our public report every day. So everyone we could see the team leaders and or the consulting team to talk about the pandemic situations, what new policies. But all the key leaders in the team decision teams are mere professors. So that is very interesting that actually they get the most very strong trust by Taiwanese populations because everyone knows they are so work hard and they have the profession to keep the pandemic stable in Taiwan. But it's difficult to have the different image, especially to girls that or the leader team are male professor. So of course they have some very we could sweet work that once we in because in Taiwan we have the face mask initiate that provided by government, so everyone could have the very cheap but very useful face mask. And once have a boys, the primary school boy, he refused to use the face mask because that is pink. That is so traditional gender stereotype. But the second day, the leader team, our decision team, they know about that. So during the public, the journals, the conference, or these 5 men, they wear pink mask. And they want to show that the pink is not the color belonging to women. I think that is and after that, one day, many of the companies in Taiwan, they changing their Facebook logo become pink. That everyone want to show to girls and boys that pink is not girls' color, is not such gender stereotype. So I want to say is in even we are now the situation that our decision team, they are really not so balanced in gender. We sometimes we complain about that. But that is maybe it's long term in Taiwan in some specialized field. Actually, we before we really did not encourage girls to join that, and we do not have the environment to encourage the female professors, female professional people to join public policies or the very important policymakers centers. So that is sometimes in one side we still need that is not good enough. Even all the team leaders, they think about gender issues, but at the same time I think in the future we need to try to encourage more girls that you are still have the ability to become just like the leader teams, just like the decision-making teams. And that is not only the middle-aged male professor's field. Thank you.
Thank you so much, Dr. Lin, and for those very relevant and specific examples, particularly that public campaign to promote pink mask wearing. So thank you for that, as colors are do not have to be gendered for sure. And also thank you to Dr. Wiles as well. So I'm going to move on to the first question in the chat. And this is from Ambassador Jane Hardy, directed to Dr. Wiles. She says, aloha all and congrats. Dr. Wiles, a very powerful presentation, very impressive. Have there been any serious responses to the discounting of New Zealand's successful COVID elimination strategy? It is gobsmacking that the idea that it is all because New Zealand is a remote island nation that it has been successful. Other such successes include my own country of Australia, 25 million, 100,000 citizens returned from overseas over the past year, Vietnam, in the middle of a highly populated region of Asia, and several other countries in other regions. Over to you, Dr. Wiles.
Yeah, so it's really, really interesting that this idea that our success, so we will point out, for example, that yes, we're an archipelago as well, and yes, we're a long way away. But look at Australia. We'll point out these other examples, and there's always an excuse. There's always something that there's some reason why we're not successful, and I think actually this is a psychological coping mechanism. Because there are clearly, many people around the world who are in despair because their governments, their leaders have really made the wrong choices. And they were ideological choices in many places, right? There are very clearly countries who have taken particular paths because of necessity, but there are others who made choices and continue to make choices that are really making it worse for everybody else. And I think one of the only ways that some people living in those countries can cope is by discounting success in others and saying that it couldn't possibly, there's reasons why it couldn't possibly be emulated there. And we're seeing this now, especially in the UK, where there's a whole group of, academics, of experts calling for the UK to take a zero COVID approach, to really do a long, hard lockdown, to get cases to a manageable, state, to use that time to stop giving money to the private sector for, test, trace, isolate systems that don't work, to fix it, and to then, rather than just relying on a vaccine rollout program. And those people are being actively discounted, again, being told there's, we couldn't possibly do it here. And it's kind of hilarious, especially the UK. The UK is an island. The UK could do all these things. Yes, it's bigger, but you could still do these things that other successful countries have done. And so somehow that discounting them is, I think, a way for people to cope with just how badly things are being managed. And it's very depressing because, it will continue to be mismanaged as, if people don't rise up and say, we want something different.
Thank you, Dr. Wiles. I'm going to move on now to the next question, and this is going to be directed to Ms. Kara Jobola-Corrales. This pandemic has demonstrated that the effects of a public health crisis are not gender neutral. Men, women, boys, and girls have been affected in different ways, including a documented shadow pandemic of gender-based violence and significant differences in economic impacts. What are some of the recommendations your feminist pandemic recovery plan makes that take gender perspectives into account? Thank you, and over to you, Kara.
Thank you. Well, within my mom's lifetime, Hawaii was not a US state, so that's very recent. And for many people, it's not understood as a neutral institution, but really a foreign government system that manages a foreign set of values. And one of those is the colonial gender binary. And, to stay within that role, when you lose control as a man, like during an economic crisis where you're facing extreme anxiety, possibly depression, questioning self-worth, and again, lack of control, one of the ways that plays out that we saw in the Great Recession was by exerting control over someone else in your life, like your intimate partner. And we've seen a massive increase in intimate partner violence documented in Hawaii, which probably you folks have documented wherever you are. And one of the most important things that we wanted to talk about in our plan is, stopping this approach of, just dealing with the acute harm, but putting back money and investing in the preventative side. So we have this, social visibility around the fact that, oh, wait, Hawaii isn't this idyllic, safest state in the nation. It's in fact very violent if we consider women and gender diverse people. And so for us, we wanted to push prevention because that was defunded right before COVID. We had a lot of the different intervention programs gutted by like 30%. So that's something we sought to restore. The other thing that I don't think is talked about enough, at least not in, is really the amount of sexual exploitation that's increased, and talking about it as exploitation rather than, this kind of lazy government response of everybody just go on OnlyFans, which has seen a 200,000 user increase every single month since March of last year. It should be an outrage that we are pushing our citizens, our undocumented folks, our most vulnerable people to have to basically Airbnb out their body to get through this crisis. That's an outrage, not something we should embrace as work. That is a failure of government. It's also a foundation of dehumanizing women and gender diverse people, and part of the reason why we are not taken seriously wherever we are and are treated as property to this day. And so for us, we wanted to focus on a just transition. It's just the same as any other bad industry that is destructive to our communities. And how do we make sure that we are doing it in a humane and sustainable way that protects our communities? So that's also in the plan. Thank you for the question.
Thank you for your input, Kara. Appreciate it. I just want to move on to a quick comment that was made at the beginning of the chat dialogue. This is from retired Admiral Mackey. Just stating that women of all races and religions are equal to men of all races and religions. So just wanted to make that comment out there. The next question, I want to direct it to Dr. Lin. And this is from Suyen Shoemaker. And the question is, Dr. Lin, what do you think Taiwan's next step as COVID vaccine has begun distributing worldwide and appears to have a positive impact in curtailing the pandemic? Will the policy change accordingly? Over to you, Dr. Lin.
Okay. Thank you. The point that I think the vaccine will be very important to change the pandemic situations. But the first that all we know the vaccine is now available in most of the bigger and stronger countries. So the problem that how we could provide this is vaccine to we said maybe more the economic weakness countries, because that is still when these countries couldn't to improve their pandemic situations, actually this will not become normal situation or the global situations. For example, in Taiwan now our situation is that we are still buying vaccine from some big companies, but because we have a much more stable situations inside and also in some international political problems, we will have vaccinations more distributions better and maybe after July. within Taiwan, of course, we think that is okay. As most of the Taiwanese people, they think much more stable here. So we keep the policies and keep all the overseas people visitors have a 2 weeks quantifications, and that all the public all in the society, all in the public area, we wear the face mask. But now we are facing another issue that in Taiwan, actually, we're depending many migrant workers, especially come from Indonesia, Vietnam, even Vietnam. During this, we say East Southeast Asia, and so we discussed with our government and our population that if we couldn't to keep the patients to share the vaccine or make most of the we said maybe some another countries could be more provide the vaccine. Actually, it will not improve or to improve the situation inside of Taiwan. I think that situation were similar with globally or with another countries. If another, we said maybe some economic weakness companies or some, we say developing countries, they couldn't get the distribution of the thing. I think the global situation will not come back no more. So in Taiwan, our viewpoint that now we are facing that, I will not say the challenge because most of the Taiwanese population say that we could keep these situations maybe over 1 year still okay. But we know in the not only migrant workers or the foreigners or the overseas workers or companies, we still need open our windows, open our door of Taiwan. And it depends several things. First, depend when the most of Taiwanese population, there could be vaccinations. And second, when another country's their vaccination improves their pandemic situations.
Thank you, Dr. Lin. Those are some excellent suggestions and recommendations. Thank you. The next question is going to be directed to Dr. Wiles, and this is from Beth Greener. And the question is, my understanding is that in New Zealand and elsewhere, the management of the COVID response has had gendered impacts. That is, for each one, gender-based violence has surged, even in managed isolation centers. A recent report suggested that police attendance at MIQ facilities was often in response to domestic violence incidences. So how have these gender relevant issues impacted the thinking about the management of future pandemic or other emergency events? Over to you, Dr. Wiles.
Actually, that's a question that I can't answer, I'm afraid, because I'm not really involved in those discussions. I mean, we're, yeah, it's a really, really good question. And I'm not aware of the, I'm not aware of that report of there being gender-based violence in the MIQ facilities. So I'll look into that. Yeah.
Thank you, Dr. Wiles. I'm going to combine kind of the next two questions because they relate to cybersecurity. The first one is any insights any of the panelists might have on women, peace, and cybersecurity during COVID-19. Have any of you have undertaken any work or come across any WPS research or policy work in relation to women's experiences online, women's role in internet governance, particularly as our lives have become so mediated by the internet during COVID-19? And then the second question was also an interest again in cyberspace, making it a safer space. This person also notes in Southeast Asia, the gender digital violence increase is up to 3 times pre-pandemic times. And there's an example here on Indonesia. If you have any recommendations or input to governments or what SCSOs have done that have been effective and replicated. So back to kind of looking at cybersecurity. So opening it up to the panelists and maybe Dr. Wiles, given some of your comments earlier, you might have some input to that. Over to you.
Thank you. Yeah, so I've only really experienced it. You know, as a woman on the internet who uses social media, I've obviously come across harassment before, but it wasn't until becoming quite a public figure in New Zealand that I've like really understood that harassment. And it's come in all forms. You know, I have I get emails, I get messages on social media. I always have people talking about me to my face and then talking about me like behind my back. Really weirdly, because of my research, I've actually ended up being implicated in a conspiracy theory. So I, many years ago, had Gates Foundation funding to work on tuberculosis. And I work on luciferases, which are enzymes made by creatures like fireflies to make light. But because they're called luciferase, and that's very close to Lucifer, there are people who basically think I'm a Satanist. So I've had a huge amount of abuse based on that as well. So it's been really interesting. And one of my colleagues is actually trying to document it all to see whether the harassment that I've experienced has been anything like, my colleagues who are men. And we've got some really clear examples like the one I showed where it's really quite gendered. What I found really fascinating is that I've spent the last year trying to get my institution to take it seriously and to help document it so that we can make, police complaints and things. And our institution has no idea. So there's a real lack of understanding that harassment that happens in the cyberspace, as a result of us doing our jobs, is even our employees' responsibility, or that they hold any responsibility of helping us deal with it. Instead, it just becomes, oh, you should maybe just not use social media then and people will stop being nasty, which is sort of making it as though it's my fault rather than actually changing people's behavior. Interestingly, things might change in New Zealand in the near future, because we had a terrorist attack a couple of years ago, and that was through online radicalization of somebody. And so there are kind of changes potentially coming in around our hate speech and things. But what's been really interesting in anticipation of these changes in law has been to see certain sides of the political house start to really try and get people thinking that their free speech is under attack. So it's really interesting to see these movements about, that are preparing for us trying to put in place some things that will protect people from harassment online, as being people have the right to harass people, which would seem the wrong thing to me. But yeah, so as somebody who's experiencing it, it's been hard. And I really look forward to seeing what our government's going to try and do to, put laws in place to help people like me who are being harassed.
Thank you, Dr. Wiles. And you raise an important point about sort of institutional mechanisms to protect the digital cybersecurity space for women and girls. And thank you for earlier sharing your story as well. Going to move on. We have a question from Dee Sawyers, and this question is to Ms. Jola Carolis. Just a thank you to everyone for the questions. And Cara, what are some of the details of the impact on women in your economic plan, which specifically address the stereotypical role of caregiver assigned to women? Cara, over to you.
Oh, apropos. Okay. So, our plan really focuses on, redistributing that as a concept and, who's responsible for that, right? Like I said at the beginning, there's this idea that it's this capitalist family, this nuclear family, and within it, the person who is expected to serve is the woman. So how do we shift that culture? I think at the policy level, we can be more aggressive about right now, since we're so behind with paid family leave, for example, how we structure it can really define how gendered it is, right? So if it's, if there is a male partner, making it contingent on both parents, what are the incentives going to be there? That's something that's up for grabs and part of the conversation that we're pushing. But again, we really want to redefine the responsibility for children in our society. And part of that is instituting free public care for children 0 to 5 years old. So that's something that we're hoping to see at the federal level instituted as just, an extension of our education system and investing in that. And I think those are my best examples, and I'm getting my cue. So
Thank you, Kara. A very relevant, relevant example, so thank you for sharing. We have a few more minutes left in this webinar, so I kind of want to round out with kind of a remaining question for the group. What would be your top advice to young girls and women who desire to be a change maker like yourself? And this is kind of a similar question. What advice would you also tell a younger version of yourself as well? And I'll open it up to the panelists, whoever would like to try to answer first. Thank you.
I can go first, I guess, if nobody else wants to. I guess, I mean, my advice to my younger self would be don't give up. And, you know, it's going to be hard, but it will be worth it, I guess. I guess what I would really like to see or what advice I would give is don't ever let, you know, it's okay not to fit. I think we have these, you know, these ideas that somehow if we don't look right or we're different in a space, that somehow we're wrong. And actually, you know, we're not wrong. We're just different, and that's really, really important. So, you know, I have pink hair. I've had pink hair for 20 odd years. I got pink hair as a student because I liked it. And then I kept it because it really annoyed people. Like, it really upset people that I was pursuing a scientific career and I had pink hair. And so for me, it's almost, I'm like a visible reminder to people that I'm going to stay and I'm going to be true to myself, and that they're just going to have to deal with it. And so that's, you know, but that's been easy for me. Well, not easy, but, you know, easy-ish for me. So I think, yeah, don't when you experience something, it's often not you, it's the system. And so don't take it personally. You know, find the people who can help you make change, I guess, even though we know change is going to be slow.
I love that. I really love that. I think just yesterday we have some publications, some articles in the social media. I think all I mentioned and all I encourage life. So in traditional Han cultures, really people will, especially girls, will worry about they are not the same with others. Especially they will be asked have the regularly to have a when to go to school, when to have a children, and when to join the what kind of style in the families. And I think that is really I really believe that especially now in Taiwan, many girls, they were limited themselves because they were afraid that if they so dominant, they were different with us, just like your pink colors. But it's really at anything you want to satisfy others actually is not need, especially girls. But usually girls are be educated not to arguing, not to fighting, and not to fighting for yourself. That is really, I think, encourage all girls that fighting for yourself. You believe you really have. You are really valuable to have all you want and to fighting for that. And everyone should to support you and company with you to work with you to make sure your life. Yeah.
Thank you, Dr. Lin, and thank you, Dr. Wiles. Kara, I'll just, if you would like to add on any pieces of advice you would like to give to.
Well, now that my kid left the room, I can say don't have children. Just kidding. Sorry, that's so negative. What I would tell not just girl me or girls or even adult women is really learn your history, your specific people's and your culture's history, the history of women in it, because without that, all of this becomes very disorienting. And it's easy to fall for the traps like, this is, you know, just natural. This is how it's always been. We can't undo this. It's too difficult. And so it's really important to be grounded in that, whatever you do. And it's very challenging to show up as a woman. It's much harder to show up as a Filipina. It's much harder to show up as a feminist in these spaces, right? Because so be ready for that resistance and make sure that you have a political support system for that when it happens. And that's all. Thank you so much, everybody.
Thank you, Cara. So just to wrap up, before I turn it over to Dr. Pryor of Pacific Forum, just a thank you to all for your excellent questions, and a special thank you to our esteemed panelists. You are inspiring and have given us a lot to think about and hopefully take positive action in our personal and professional lives. I think what we've seen and heard is that including women's perspectives are not just the right thing to do, it is also the smart thing to do in truly achieving a safer, more secure future for all of us. And with that, I'll turn it over to Dr. Crystal Pryor with Pacific Forum to wrap up. Aloha.
Thanks so much, Sharon, and thanks so much, everyone, our panelists and participants both, for joining us today. We hope you'll continue staying engaged with Pacific Forum programming, which you can find out more about on our website, www.pacforum.org. We have forthcoming research papers on women, peace, and security to be published in Pacific Forum's journal Issues and Insights, as well as a 3-part PACnet series, the first of which was published today on WPS under the new Biden-Harris administration. You can find the link to that now. Kindly take a moment also to complete our post-event survey, which you can again find the link to in the chat box now. We'd really appreciate if you take a couple minutes to fill that out. And finally, I'd like to make you all aware of a new fellowship opportunity at the Pacific Forum. We're offering a Women, Peace, and Security Fellowship for young professionals to conduct research and analysis in key country and thematic priority areas related to women's rights and the promotion of women's participation in peace and security policy at international levels in dialogues, policies, and peace processes. Applications are now open and due on March 15th. It's coming right up. You can find more details, including the application form, on the link in the chat box now. The fellowship runs from this April through the end of September and will be virtual until conditions allow relocation to Honolulu, unless you happen to already be here. It does include a monthly stipend. Please share this opportunity broadly to all of your networks. Thank you so much again to our panelists for joining us today, and to the US Indo-PACOM for making this event possible. We hope that we'll see you all at a future event.